That leads me, Dr. Pawar, to my next question and my next point. I'm
Sure.
sure as a medical expert, you have gotten this question many times. Will this cure me?
The patient is so much worried. The caretakers of the patient are so much worried. So they will always ask this question. Whether this medication is going to take care of the patient or cure. Now try to understand. Currently this medication is going to take care of the symptoms. And which symptoms? As we have discussed, definitely is going to take care of pain in totality. It's acting at the central level, it's acting at the peripheral level. So it's going to reduce the pain, it's going to reduce the inflammation, it's going to reduce the nausea, it's going to reduce the anxiety. But at the same time, it's going to increase the appetite so that patient feels well. So overall, it will take care of the symptom management. But yes, now let me tell you, there are several research going on. In fact, we are doing some studies with the medication for looking at the anti-tumor effect. So that will be added advantage. But yes, we have to wait for some time till we get the results. And I am very hopeful the results are encouraging. And if it has anti-tumor effect, that means it's going to take care of the pain, it's going to take care of inflammation. At the same time, it will have anti-tumor effect, which will help the patient to get cured fast.
I think that's a very mature and measured way of looking at it, Dr. Pawar, and I believe this will help patients understand that when we are focusing on symptom management, it helps the body have the lead time to be able to recover, be able to optimize on existing therapies or treatments, and be able to reach a state of natural health and optimum health soon. And I think what's equally important is to also provide people with that inkling of hope, as you did, that with our work and our research at BOHECO, there could be a future where there is clinical data to show how cannabis-based medicines work on the curative side. But for now, we're focused entirely on symptom management. And that leads me to my next question and my next thought for you, Dr. Pawar, is, as you correctly said, we're looking at different factors: anxiety, appetite, mood, sleep, a host of other areas, which, as you very well understand, come together in the bouquet of what we call quality of life, and improving the quality of life of patients in India and worldwide through cannabis medicines. Can you help us dive a bit deeper and help understand how at a QOL or a quality of life level these cannabis-based medicines can make a difference and impact in a patient's life?
So for most of the doctors, the quality of life is very important. In fact, many times the caregivers come, we hear the quality of the patients is compromised. And if you remember my earlier statement, in stage 4 cancer patients who are suffering from pain, 98% of the patient do not have access to palliative care. And pain is one of the most important symptoms. And the quality of life is absolutely compromised. So what is important? Yes, treating the patient is important and we want to cure the patient. But that will take its own due course of time. But at the same time, as we have discussed, that pain is one of the very important symptoms. And we have already seen why the pain arises. So pain arises because the tissues are getting damaged. The immune response is there, which further increases the pain, the inflammation. So when we are taking care of the pain, most important, pain, and along with that, if we are going to take care of the other associated pathological factors, like we are going to take care of the inflammation, where we are going to reduce the anxiety of the patient, where we are going to reduce the nausea, where we are going to increase the appetite. So overall, if you see, if you look the patient as a totality, that means it's going to take care of the symptoms, and thereby once you reduce the pain, when you increase the appetite, when his food intake increases, when the mood elevates, the patient feels better and the quality of life in such patient improves. And I think so that is one of the most critical elements when we manage such patient.
Fascinating, Dr. Pawar. I believe you could go so far as to call this a game changer for the long term. When we're looking at it from a kaleidoscopic point, it's not binary about only one or two indications. Now, the question, as you correctly posed, is can we tackle multiple symptoms and multiple ailments that contribute by tackling successfully, contribute to the betterment of the patient's health for the larger good as well. Keeping this in mind, Dr. Pawar, I'd like to move on to sort of my next thoughts and my next questions for you. And I'd maybe like to start with an interesting piece of trivia that I picked up along the way. As you know very well, in the United States and Canada, they have a very large growing medical cannabis industry. But along this journey, through my reading and my research, I learned that close to 60% of patients in many states in the United States who are consuming medical cannabis formulations or medical cannabis in different forms are above the age of 60 years old. That is, they are in the elderly and the geriatric population. Now, as we understand, our elderly population in India suffers from a vast array of pain, insomnia, anxiety, and inflammatory issues. Keeping these factors in mind, would you like to highlight a bit more from your experience about how these cannabis-based medicines can tangentially have a positive impact on the elderly patients in India, quite similar to what's happening in the rest of the world?
Yes, all the international data what you shared is correct, and the same percentage we see in India also. As we all know, the Indian age is also increasing, and as the age increases, the incidence of cancer in this patient definitely increases. So when it comes to elderly population, it is very important how do we manage them. As I said, each patient is different. So elderly category itself is a large percent of patients suffering from cancer. Sometimes we get patients who are more than 80 years old, more than 90 years old. And what do we say? We should not treat this patient. Indeed, we have to treat each and every patient. Quality of life is important for each and every patient. But we have to be cautious. So when it comes to elderly patient, titration of dose becomes very important. That's why we always advise that you have to titrate slowly, start with the smallest dose. Because it's obvious, elderly patient will have a lower metabolism. The incidence of low blood pressure will be high. There will be drowsiness, there will be dizziness, which is expected. So we have to start at a lower dose, titrate and gradually increase as per the response from the elderly population. So that is very important, so that we reduces the adverse drug reactions. Now also one point you should remember, most of the elderly patients will be also suffering from some other ailments, maybe high blood pressure, maybe cardiac disease, maybe diabetes, so many other. So we should be aware about some drug interaction in these people, and in general also we should be aware about the drug interactions. So whenever you are using cannabinoid based medicine, so we should be aware about the drug interactions. We should take care if the patient is already on blood thinners, sedatives, or any of the pain management medication. So titration of the dose becomes important, and if there is some adverse event due to drug interaction, we should be able to take care. But yes, final word of caution, that in such category of patient, it's always better to take consultation from a specialist in this area.
I think you make some very valuable points on this, Dr. Pawar, and I think the most important being start low, go slow when dosing. Keep in mind that other ailments or illnesses and other medications that are attached to that may be part of your treatment and regime. So that has to be kept in mind when you're having cannabis medicines. And I think the holy grail of what you said is always consult a medical expert to get the right kind of opinion basis yourself as a patient, which I think is extremely valuable in terms of the insights that are required for patients to make better decisions when using cannabis-based medicines.
Indeed.
Right. So, Dr. Pawar, this has been an extremely insightful, I would say, knowledge-enhancing session together, where we've gotten the chance to learn from your decades worth of expertise of how cannabis-based medicines and how medicines and healthcare in general work for the larger patient and audiences in India and the world. And I think on that note, I'd like to take this opportunity to thank you for your time, and most importantly, for our patient viewers, listeners, and users. Thank everyone for tuning in for another insightful session where we hope to keep educating, bringing more scientific information in the most normal way and most simple way possible to you, so that you build the confidence to adopt cannabis based medicines into yours, your family members, or your friends' lives basis their needs for health as well as their lifestyle. Thank you so much, everyone.